If you've ever looked up Stelara and thought, wait, this one drug is for skin, joints, and gut issues, you're not crazy. Ustekinumab is one of those medications that shows up in a bunch of autoimmune conditions, and the label can feel like a foreign language. Quick reminder before we start, this is educational info, not medical advice. For personal decisions, side effects, and medication changes, your doctor or pharmacist is the right person to loop in. Now, the quick origin story, since people ask. Stelara, which is Ustekinumab, was developed by Centocor, a Johnson & Johnson company, and it was first approved by the US FDA in 2009. So what is Stelara? Stelara is what's called a biologic. That just means it's not a simple little chemical pill. It's a lab-made antibody designed to target a specific immune signal. Stelara is an interleukin-12 and interleukin-23 antagonist, which is a fancy way of saying it blocks two immune pathways that can drive inflammation. If your immune system is like a smoke alarm, autoimmune diseases can be like a smoke alarm that won't stop screaming even when there's no fire. Stelara is basically trying to turn down the volume on the specific part of the alarm system that's stuck blaring. Now, what is Stelara used for? Stelara is approved for a few different conditions, and it helps to group them because it makes the whole thing feel less random. First bucket is skin. It's used for moderate to severe plaque psoriasis. Second bucket is joints. It's used for psoriatic arthritis. Third bucket is gut inflammation. It's used for Crohn's disease and ulcerative colitis. One detail that matters if you're explaining this cleanly. Psoriasis and psoriatic arthritis can be in adults and also in pediatric patients age 6 and older. Crohn's disease and ulcerative colitis on the US labeling are adult indications. Now, how does it feel when it's working? People usually aren't looking for a miracle overnight. With autoimmune conditions, the real goal is fewer flares, less inflammation, less damage over time, and more normal days. For psoriasis, that can mean the plaques calm down and the skin gets smoother. For psoriatic arthritis, it can mean less swelling and pain and less morning stiffness. For Crohn's and ulcerative colitis, it can mean fewer bathroom emergencies, less bleeding, less abdominal pain, and more stable days. Now let's get into side effects because this is where people want the plain English. Common side effects with Stelara can include things like coldish infections like upper respiratory infections, headache, tiredness, and injection site reactions like redness, swelling, or soreness. Some people also report nausea or diarrhea depending on the person and the reason they're taking it. A lot of those are annoying, but not necessarily scary. The big safety theme with Stelara is this: it affects the immune system. So the big risks are the ones tied to a lowered or altered immune response. Let's talk about the main warning categories people should understand. First, serious infections. Because Stelara changes immune signaling, it can increase the risk of infections, and it can make infections harder to fight or easier to miss until they're bigger. This is why labels emphasize not starting during a clinically important active infection and why doctors tend to ask about fevers, chronic cough, recurrent infections, and stuff like that. If someone taking Stelara develops signs of a serious infection, like high fever, chills, shortness of breath, chest pain, severe weakness, or an infection that's rapidly getting worse, that's not a wait and see for 3 weeks situation. That's a get medical attention situation. Second, tuberculosis screening. The label specifically talks about evaluating patients for TB before starting Stelara and treating latent TB before using it. Again, this is one of those don't wing it meds. It's usually a planned decision with screening. This is a big one, and it's honestly one of the most useful things you can say in a video because a lot of people have no idea. People being treated with Stelara should avoid live vaccines. The label also calls out BCG specifically, and it even mentions being cautious with live vaccines given to household contacts because of the potential risk of shedding and transmission to someone whose immune system is being suppressed. So the practical, real-life takeaway is simple. If you're on Stelara, don't casually get vaccinated without telling your healthcare team what you're taking. And don't assume every vaccine is the same type. Some are live, some are not. Your clinician can guide that. Fourth, malignancy, meaning cancer risk. Because Stelara is an immunosuppressant, the label notes it may increase the risk of malignancy. Most people hear that and instantly panic. Here's the calmer way to think about it. It doesn't mean this drug equals cancer. It means the immune system plays a role in immune surveillance, and when you suppress parts of it, you may increase risk. That's why clinicians pay attention to a patient's history and why skin checks and new or changing lesions come up on the label. Fifth, serious allergic reactions. Severe hypersensitivity reactions can happen, including during the first intravenous dose in some cases. If someone develops symptoms like swelling of the face or throat, trouble breathing, chest tightness, feeling faint, or widespread rash, that's emergency territory. This is rare, but it's important because it's one of those things where you want people to recognize the name and not ignore the symptoms. PRES stands for posterior reversible encephalopathy syndrome. The label describes symptoms like severe headaches, seizures, confusion, and vision changes. If those show up, it's urgent. And here's one more rare category that's worth a quick mention because it's sneaky: non-infectious pneumonia. There have been reports of lung inflammation types like interstitial pneumonia or eosinophilic pneumonia in post-approval use. That can present as cough, shortness of breath, and breathing trouble, sometimes after only a few doses. Again, rare, but if someone on an immune-modulating drug develops new or worsening breathing issues, that's not something to brush off. Now let's do the what to avoid section, but I'm going to phrase it the right way. With Stelara, it's less about one forbidden food and more about avoiding situations where the risk math gets ugly. So here's what to double check. 1. Live vaccines. That's the cleanest avoid on the label. 2. Ignoring early infection signals. If you've got fever, chills, weird cough, painful urination, infected skin, or you just feel sick in a way that's unusual for you, don't do the tough guy thing. This is exactly when you loop in a clinician. 3. Stacking immune suppression without coordination. Some patients do end up on more than one immune-modulating medication depending on their disease and severity, but the important piece is coordination. If different doctors are prescribing different things, it's easy for people to accidentally end up with more immune suppression than anyone intended. 4. Surprise procedures and surprise providers. If you're getting surgery, dental work, or you're seeing a new specialist, it helps to say, "I'm on Ustekinumab," right up front. Not because you're being dramatic, but because it changes the risk conversation. Now let's do a quick what it's not section, because this can keep your comment section from turning into chaos. Stelara is not a general pain reliever. It's not an antibiotic. It's not a steroid, even though people sometimes lump all anti-inflammatory meds together. And it's not something where it makes sense to compare your experience to somebody else's dose schedule or timeline, because autoimmune disease severity, past meds, and risk factors vary a lot. So what's the clean takeaway? Stelara Ustekinumab is a biologic medication that targets immune pathways involved in inflammation, specifically IL-12 and IL-23. It's used for plaque psoriasis, psoriatic arthritis, Crohn's disease, and ulcerative colitis. The common side effects tend to be things like mild infections, headache, tiredness, and injection site reactions. The serious categories to respect are serious infections, TB screening concerns, vaccine restrictions like avoiding live vaccines, malignancy warnings, severe allergic reactions, rare neurologic issues like pre-S, and rare lung inflammation. If you want 3 simple questions that make a doctor or pharmacist give you a straight answer, use these. 1. What infections or symptoms should make me call right away while I'm on Stelara? 2. Are my vaccines up to date? And are there any vaccines I should avoid while I'm taking this? 3. Based on my history, do I have any extra risk factors like past TB exposure, frequent infections, or cancer history that change how we monitor this? That's MedLabel Translator. No hype, no panic, just the label translated into normal language.